Good day everyone. Our topic today is all about adaptations to resistance training. Resistance training and gain in muscular fitness, maintaining an active lifestyle. It is important in maintaining muscular fitness, but resistance training programs are necessary to increase strength, power, and endurance. Mechanism of gain in muscle strength. Gain in muscle size are generally paralleled by gains in strength. Losses in muscle size correlate highly with losses in strength. So, as you can see, this is the line graph of mechanism of gain in muscle strength. Neural control of strength gain. It develops motor neuron pathways that enhance an athlete's brain-body coordination during functional movements. Motor unit recruitments, stimulation, frequency, and other neural factors are also important to strength gains. So, this is the line graph of neural control of strength gains. Asynchronizations and recruitment of additional motor units. Motor units are generally recruited asynchronously. They are all called on the same instant. They are controlled by a number of different neutrons that can transmitted either excitatory or inhibitory impulses. Increased rate coding of motor units. The increase in neural drive of motor neutrons could also increase the frequency of discharge or rate coding of their motor units. Autogenic inhibition, inhibitory mechanism in the neuromuscular system, such as the Golgi tendons organs, might be necessary to prevent the muscle from the bones and connective tissue can tolerate. So this is the example of autogenic inhibition. So we have a contract and relax. Other neutral factors can contribute to strength gains with resistance training. One of these is referred to as coactivation of agonist and antagonist muscles. The agonist muscles are the primary movers, and the antagonist muscles act to impede the agonist. Muscle hypertrophy. Muscle hypertrophy means lifting weight to improve muscle strength and definition. Two types of hypertrophy. First, we have transient hypertrophy. Transient hypertrophy is the increase in muscle size that develops during and immediately following the single exercise boot. Second, chronic hypertrophy. It refers to the increase in muscle size that occur with long-term resistance training. Fiber hypertrophy. It refers to an increase in the size of the cell. So, fiber hypertrophy refers to an increase in muscle size to achieve through exercise. So, if you want to improve muscle definition, lifting weight is the most common way to increase hypertrophy. So, as you can see, this is the micrograph of fiber hypertrophy. Fiber hyperplasia. It refers to an increase in the number of cells of fibers. So, this is the micrograph of fiber hyperplasia. Integration of neutral activation and fiber hypertrophy. Neutral adaptations resulting in increasing voluntary activation of muscles. So, this is the example of cycle in integration of neutral activation and fiber hypertrophy. Muscle atrophy and decreased strength with inactivity. When a normally active or highly trained person reduces his or her level of activity or ceases training altogether, major changes occur in both muscle structure and function. Immobilization. When a trained muscle suddenly becomes inactive through immobilization, major changes are initiated within the muscle in a matter of hours. The training program focused on the lower extremity using full squat, leg press, and legs extension. So as you can see, this is the bar graph of squat, leg press, and leg extension. Fiber type alliteration. This is the bar graph of fiber type alliteration.
Muscle soreness and cramps. Muscle soreness generally result from exhausted or very high-intensity exercise. This is particularly true when people perform a specific exercise for the first time. So, while muscle soreness can be felt at any time, there is generally a period of mild muscle soreness that can be felt during and immediately after exercise, and then a more intense soreness felt a day or two later. Acute muscle soreness or AMS. The pain felt in muscles during and immediately up to 24 hours after strenuous physical exercise. The pain appears within a minute of contracting the muscle, and it will disappear within 2 or 3 minutes or up to several hours after relaxing it. There are following causes have been proposed for acute muscle soreness. First, accumulation of chemical end product of exercise in muscle cells such as lactic acid and H+. Second, muscle fatigue. The muscle tires and cannot contract anymore. There are no modern effective treatments for AMS. And additional to that, edema is the cause of acute muscle swelling that people feel after heavy endurance or strength training. The pain and soreness usually disappear within a few minutes to several hours after the exercise. Thus, this soreness is often referred to as acute muscle soreness. Delayed onset muscle soreness or DOMS. Muscle soreness felt a day or two after a heavy out of exercise is not totally understood yet. So researchers are continuing to give a greater insight into this phenomenon. Because this pain does not occur immediately, it is referred to as delayed onset muscle soreness or DOMS. DOMS is classified as a type muscle strain and can vary from slight muscle stiffness to severe debilitating pain that restricts movements. Inflammatory reaction. Inflammation is a result of damage to body tissues and can be caused by a number of factors including trauma, repetitive use, and those conditions affected by age such as osteoarthritis. This observation led some investigators to suggest that soreness results from inflammatory reaction in the muscles. There are four sequences of events in DOMS. First, high tension in the contractile elastic system of muscle results in structural damage to the muscle and its cell membrane. This is also accompanied by excessive strain of the connective tissue. Second, the cell membrane damage disturbs calcium homeostasis in the injured fiber, inhibiting cellular respiration. The resulting high calcium concentrations activate enzymes that degrade the Z-lines. Third, within a few hours is a significant elevations in circulating neutrophils that participate in the inflammatory response. Fourth, the products of macrophage activity and intracellular contents, such as histamine kinase and K+, accumulate outside the cells. These substances then stimulate the free nerve endings in the muscle. This process appears to be unsituated in eccentric exercise, in which large forces distributed over relatively small cross-sectional areas of the muscle. Delayed onset muscle soreness and performance. DOMS is the result of injury to the muscle or edema independent of muscle injury. The affected muscles are not able to exert as much force when the person is asked to apply maximal force, such as in the performance of a IRM strength test. It has been proposed that the loss of strength in the result of three factors. First, the physical disruption of the muscle as illustrated in figures 10.8 and 10.9. Second, failure within the excitation, contraction, coupling process. Third, loss of contractile protein. Failure in excitation, contraction, coupling appears to be the most important, particularly during the first 5 days. This is illustrated in figure 10.10. Reducing the negative effects of DOMS. Reducing the negative effect of DOMS is important for maximizing training gains. The eccentric component of muscle action can be minimized during early training, but this is not possible for athletes in most sports. Muscle soreness can be minimized by using lower intensity and fewer eccentric contraction early in training. However, muscle soreness may ultimately be an important part of maximizing the resistance training. Exercise-induced muscle cramps. Skeletal muscle cramps are a frustrating problem in sport and physical activity and commonly occur even in highly fit athletes. Skeletal muscle cramps can come during the height of competition, immediately after competition, or at night in the deep of sleep. Muscle cramps are equally frustrating to scientists because there are multiple and unknown causes of muscle cramping and little is known about the best treatment and prevention strategies. Although muscle cramps can be the result of rare medical conditions, most exercise-induced or exercise-associated muscle cramps are unrelated to disease or medical disorder. Exercise-associated muscle cramps have been defined as painful spasmodic involuntary contractions of skeletal muscles that occurs during or immediately after exercise. Nocturnal muscle cramps may or may not be associated with exercise. To prevent EAMCS or exercise-associated muscle cramps, athletes should first be well conditioned to reduce the likelihood of muscle fatigue. Second, regularly stretch the muscle groups prone to EAMC or exercise-associated muscle cramps. Third, maintain fluid and electrolyte balance and carbohydrate stores. And the last one, reduce exercise intensity and duration if necessary. Resistance training for special populations. Until the 1970s, resistance training was widely regarded as appropriate only for young, healthy male athletes. This narrow concept led many people to overlook the benefits of resistance training when planning their own activities. Sex and age differences. In recent years, considerable interest has focused on training for women, children, and people who are elderly. As mentioned earlier, in this chapter, the widespread use of resistance training by women, either for sport or health-related benefits, is rather recent. Substantial knowledge has developed since the early 1970s, revealing that women and men has the same ability to develop strength, but that on average, women may not be able to achieve peak values as high as those attained by men. Resistance training for sport. Resistance training by field event athletes and competitive weightlifters makes intuitive sense. The need for resistance training by the gymnast, distance runner, baseball player, high jumper, or ballet dancer is less obvious. Training is costly in terms of time, and athletes can't afford to waste time on activities that won't result in better athletic performances. Thus, some performances measurement is imperative to evaluate any resistance training program's efficacy. So, resistance training can benefit almost everyone regardless of person's sex, age, or athletic involvement.